So hi there, my name is Sebastian Zewes. I'm from Germany and I work at the hospital of Augsburg. And it's my first time at VEITH. Actually, this morning I was able to give a presentation within the Session Worldwide podium. And I think it's a great opportunity to be able to do that. I don't know if you guys already gave a presentation too, or if you have been to VEITH before.
I've been to VEITH since the beginning of my career. It's always been perceived as the most prestigious meeting to go to, and the one that vascular surgeons and affiliated specialties get very excited about. But it's usually a program in which the world experts speak at, so it's a great, the associate faculty actually gives a great opportunity to younger generation of vascular surgeons, to the generation who will be the future leaders, I suppose, in vascular surgery, and it really gets them ready for their future and for being able to participate in eminent congresses like this.
Yeah, true, that's true. What do you think of it?
I agree. I'm Dr. Jennifer Perri. I'm a second-year resident at Dartmouth-Hitchcock Medical Center, and I came to my first VEITH conference in 2013. I had done a rotation in vascular surgery at Mount Sinai, but I was still deciding what specialty to pursue, and VEITH was actually the deciding factor. I was able to meet attendings I had read only about in books, who actually were quite interested in interacting with me, and the VEITHsymposium committee allowed me to put together a poster presentation. And despite the fact I didn't win at that time, I certainly learned quite a bit, and it amazed me that all these vascular surgeons came together to convene on how they did their individual surgeries. So for me, VEITH was actually specifically a deciding factor in pursuing the specialty.
It also gives one the opportunity, because within the associate faculty sessions, it's a smaller it's a closer environment. It gives you the chance to talk to people, as you were mentioning, who you only read about in books, and now you actually get the chance to talk to them in person. I think that's a great way to learn to interact with leaders right now, so we can be leaders later on.
I think what the associate faculty does as well is it gives a little more scope to the program, in that you have younger surgeons coming up who are doing new and, I suppose, innovative and breakthrough technologies. So they're able to, there's a forum for them to present these I suppose, newer techniques to their colleagues. There's a little bit more leniency and breadth in the program than there is in other congresses.
And the people you meet actually certainly do remember you. So I went to as many lectures as I possibly could during VEITH week, but because 3 rooms run at the same time, you can't see everyone you want to see. And for a really small price, you can purchase the videos afterward. So before every residency interview, I would look at my VEITH videos of the faculty that I would be meeting the next day. And that certainly helped in terms of knowing that the types of research they were doing, the kinds of cases that center was expert on. And on one of my interviews in California, a highly regarded institution, I was actually told I was the most prepared interviewee they had seen out of 300 resident and faculty applicants. And that was because I had spent the time to look at all of these VEITH videos and know their research.
So VEITH is the, leading on from that, Jennifer, VEITH is the one congress that is not afraid of controversy. And I suppose we've seen that a lot. It sort of prides itself in controversy. And even in the current program this year, there's innovative ways in treating aortic aneurysms and dissections. And if you look at the program, it's most of the program is actually about thoracic aorta, which at the moment is the hot topic within vascular surgery. And it's also the topic that has the most controversy with devices such as the multilayer flow modulator, etc. It's really a congress that, like Jennifer was saying, gets young vascular surgeons really enthused and really drawn towards this specialty.
So to sum it up, to conclude, what we would like to tell all our young colleagues is that VEITH really is a great opportunity to see what's going on in the field, number one, but also to use that chance and get a little experience doing podium presentations, because this is what we want to do later on too. So it's really a great chance, and I absolutely come to VEITH 2016 next year again. It will once again give you great opportunities to meet people and to present your own work too.